NCLEX RN practice questions for 2026. Question 1. A nurse forgets to administer a client's diuretic and the client experiences an episode of pulmonary edema. The charge nurse would consider the medication error to constitute negligence because the situation contains which element? Purposeful failure to perform a healthcare procedure, unintentional failure to perform a healthcare procedure, act of substituting a different medication for the one ordered, failure to follow a direct order by a physician. Negligence is the unintentional failure of an individual to perform or not perform an act that a reasonable person would or would not do in the same or similar circumstances. A purposeful failure to perform a procedure would be the opposite of negligence, which is unintentional. Substituting a different medication does not fit the description of the situation in the question. Failure to follow a direct order does not fit the description in the situation in the question. Cognitive level, applying client need, management of care integrated process, nursing process, assessment content area, fundamentals. Question 2. A client asks why a diagnostic test has been ordered and the nurse replies, "I'm unsure but we'll find out for you." When the nurse later returns and provides an explanation, the nurse is acting under which principle? Non-maleficence, veracity, beneficence, fidelity. Fidelity means being faithful to agreements and promises. This nurse is acting on the client's behalf to obtain needed information and report it back to the client. Non-maleficence is the duty to do no harm. Veracity refers to telling the truth, for example, not lying to a client about a serious prognosis. Beneficence means doing good, such as by implementing actions, e.g. keeping a salt shaker out of sight, that benefit a client, heart condition requiring sodium-restricted diet. Cognitive level, understanding client need, management of care integrated process, nursing process, implementation content area, fundamentals. Question 3. An individual has a seizure while walking down the street. During the seizure, a nurse from a physician's office is noticed driving past without stopping to assist. The individual sues the nurse for negligence but fails to win a judgment, for which reason? The nurse had no duty to the individual. The nurse did what most nurses would do in the same circumstance. The nurse did not cause the client's injuries. The nurse was off duty at the time. To be guilty of negligence, the nurse must have a relationship with the client that involves a duty to provide care. The relationship is usually a component of employment. The nurse did not necessarily do what others would do in this situation. Although the nurse did not cause the client's injuries, it does not prevent the nurse from assisting in this situation. Although the nurse was off duty, the nurse could have assisted if motivated to do so. Cognitive level, understanding client need, management of care integrated process, nursing process, implementation content area, fundamentals. Question 4. An adult female ambulatory care client receiving an oral anticoagulant is given aspirin for a headache while visiting a neighbor, who is a nurse. The client subsequently has a bleeding episode because of a drug interaction. The legal nurse consultant interprets that which necessary elements of malpractice are missing from this case: breach of duty, duty owed, injury experienced, causation between nurse's action and injury. There was no nurse-client relationship because the nurse was acting as a neighbor and not in an employment capacity. Thus, there can be no duty owed. Intent is not a necessary element of malpractice, because malpractice can occur because of unintended actions as well. There was no breach of duty because there was no official nurse-client relationship, which accompanies an employment situation. There was injury experiences because of this event. The bleeding was caused by the interaction of the aspirin with the anticoagulant. Cognitive level, analyzing client need, management of care integrated process, nursing process, evaluation content area, fundamentals. Question 5. A client with cancer has decided to discontinue further treatment. Although the nurse would like the client to continue treatment, the nurse recognizes the client as competent and supports the client's decision using which ethical principle? Justice, fidelity, autonomy, confidentiality. Autonomy refers to the right to make one's own decisions, which is the principle supported in this situation. Justice refers to fairness. Fidelity refers to trust and loyalty. Confidentiality refers to the right to privacy of personal health information. Cognitive level, understanding client need, management of care integrated process, nursing process, implementation content area, fundamentals. Question 6. The healthcare provider orders a medication in a dose that is considered toxic. The nurse administers the medication to the client, who later suffers a cardiac arrest and dies. What consequence can the nurse expect from this situation? The healthcare provider can be charged with negligence, being the person who ordered the dose. As the employing agency, only the hospital can be charged with negligence. The nurse and physician may be terminated from employment to prevent a charge of negligence to the hospital. Negligence will not be charged, as this event could happen to any reasonable person. Healthcare providers who prescribe incorrect dosages of medications are liable for their errors. The nurse is open to a charge of negligence for failing to verify and question the incorrect dose. The hospital can be sued as the responsible employing agency, but the healthcare provider and the nurse can also be charged with negligence. Terminating the healthcare provider and nurse from employment would not stop a lawsuit charging negligence for employee actions that have already taken place. Prescribing and administering incorrect doses are not considered events that routinely happen to a reasonable person. Cognitive level, applying client need, management of care, integrated process, nursing process, implementation, content area, fundamentals. Question 7. A nurse and teacher are discussing legal issues related to the practice of their professions. The teacher asks what the functions are of the Nurse Practice Act, NPA, in that state. The nurse would include which thoughts in a response? Accredit schools of nursing. Enforce ethical standards of behavior. Protect the public. Define the scope of nursing practice. A state's NPA serves to protect the public by setting minimum qualifications for nursing in relation to skills and competencies. One way it fulfills responsibility to protect the public is by defining the scope of nursing practice in that state. The State Board of Nursing approves schools to operate but does not enforce ethical standards. A state NPA has no role in setting liability insurance rates for nurses. Cognitive level, applying client need, management of care, integrated process, nursing process, implementation, content area, fundamentals. Question 8. A staff nurse concerned about maintaining client confidentiality would take which action while carrying out assigned duties? Read the records of clients not assigned to the nurse to become familiar with disease processes. Share information about a client with nurses from the unit to which the client may eventually be transferred. Allow the client's family to review the medical record to obtain answers to their questions. Share information about the client with those involved in planning nursing care. Client confidentiality is maintained when the nurse shares client information only with those currently involved in the plan of care. Staff should only access information about clients currently assigned to their care and should not access information about other clients on the unit not assigned to them. Client information should not be shared with nurses who are not currently working with the client. Family members would need approval from the client and the healthcare provider prior to reviewing a medical record. Cognitive level, applying client need, management of care, integrated process, communication and documentation, content area, fundamentals. Question 9. The nurse working in an acute care environment would utilize which strategies to reduce the risk of malpractice litigation? Discuss any errors with the client and family in detail. Keep incident reports on file. Maintain expertise in practice. Offer opinions to clients when the situation warrants. Maintaining expertise in practice by keeping up to date in knowledge and skills aids in reducing the risk of malpractice claims by fostering continued competence in practice. Unsafe staffing levels can result in a higher incidence rate of errors, which could later lead to charges of malpractice. Thus, reporting such situations so they can be prevented should be beneficial. Discussing errors in detail with the client and family does not reduce the risk of malpractice claim. Incident reports should be kept on file but do not decrease the risk of malpractice litigation. The nurse should not offer opinions at any time as this not part of therapeutic communication. Cognitive level, applying client need, management of care, integrated process, nursing process, implementation, content area, fundamentals. Question 10. A client is referred to a surgeon by the general practitioner. After meeting the surgeon, the client decides to find a different surgeon to continue treatment. The nurse supports the client's action, utilizing which ethical principle? Beneficence, veracity, autonomy, privacy. Autonomy is the right of individuals to take action for themselves. Beneficence is an ethical principle to do good and applies when the nurse has a city to help others by doing what is best for them. Veracity refers to truthfulness. Privacy is the non-disclosure of information by the healthcare team. Cognitive level, applying client need, management of care, integrated process, nursing process, implementation, content area, fundamentals. Question 11. The registered nurse, RN, must delegate care of an assigned client to an unlicensed assistive person, UAP, for the shift. Which client would be best to delegate to the UAP? A client who would benefit from talking about the recent death of her husband. A client with a urinary drainage catheter and nasogastric feedings who is on bed rest. A client with an osmotic who has persistent problems with leakage. A client who was transferred from the critical care unit 3 days ago is ambulatory. Factors to consider when delegating care include complexity of task, problem-solving innovation required, unpredictability, and level of client interaction. The ambulatory client is best to delegate because this client is unlikely to be stable with a low level of unpredictability. The client who recently lost her husband would benefit from professional communication with the RN and requires a high level of client interaction. The client receiving enteral feedings and is immobilized represents a more complex client, who is better assigned to a licensed nurse. The client with a leaking osmotic would benefit from problem-solving innovation and is best cared for by the RN. Cognitive level, analyzing client need, management of care integrated process, nursing process, planning content area, leadership and management.